That's big number. So the 3 is okay now. But sometimes if there are 4, mostly have 3. So sometimes 1, 2, 1, 2, 1, 2.
So the painting in here, the painting you see in here are also the painting is also 5 years old.
This place when I came it was just like this because it was a new block. This one is the first one. That one is older than this one. So this painting, no. When I came here, they haven't touched it.
Really? 3 beds, I'm told they are enough for now because the women don't come, in that large numbers to deliver. And so from the labor ward, they are moved in here to recuperate before they are discharged. And also in here, the roof, the ceiling, in fact, is also gone so bad, peeling off. I am told if I touch it with a stick, I should dodge because it might fall on my head. The painting here has been like this since the person in charge of this unit has been here. She's been here for 5 years and she hasn't seen any painting in this room, so you can imagine. Labor ward.
Yes.
That's what the roof is a register. It's like you can't. Goodness. Okay. So this is where. What table is this here?
This is a couch where they lie down for the delivery. They will spread their Macintosh. Then you have.
Okay, let me have a look at
something like this delivery sheet before they lie on it for the delivery because of the blood. But here.
Okay, so how old could this bed be?
It was here before I came, so I don't know the age now.
It is possible that when a woman is pushing and pushing and with all the energy being exerted, this could come down. This bed could go down.
When they are pushing, I stand here, so I receive the baby from here. They put their legs here. By then the woman, the size will reduce. But after they've delivered, before they spread their legs, they pull this one, yes. But before the delivery, they lie and in that position.
I believe this could be one of the reasons why they don't want to come and deliver here, because they look at the things that we have. Definitely.
They lie like this. They put their one leg here, then they squat like this. Before
this is pushed in, and so you are like that.
Yes, I received it. Yes. Just this morning I discharged somebody. Sometimes 3, sometimes 2.
So okay, so in a week, how many mothers come here to deliver? Or women come here to deliver?
Let's say 10. Can be 10. Because sometimes 2 in a day. Sometimes 3 days you won't get any. And sometimes 2 in a day. So within 1 week, 10.
Okay. But do you have enough gloves to use?
Gloves. Right now I have. Because it depends. When the cases come, sometimes we'll be short of gloves. But just recently they've gone to medical stores to bring some gloves. So right now I have.
So when you are short of gloves, what do you do? And there are women here to give birth.
There was a time we went and borrowed from the barracks. We have barracks here. So sometimes they bring some they give us some. And also from our cheap area, because they don't deliver, and they be having extra. So they send us some to do the delivery.
Do you Do you sometimes feel like going to a different facility to work there in a more comfortable environment?
Oh, yes. Like for that, like this is a very big place. As for that place, doctor is also around to help. So you won't be so stuck to receive difficult labor. But here, when you have difficult labor, you have to refer. Even getting the car is very difficult. So I have a list of drivers there. Sometimes when I call them, I have no petrol. The car is not with me and all those kind of things. But we have a particular man who always helps us to send our cases to the hospital. So it's like that. When I get an order, I like it because the doctor is there to help. Here, when you have something very difficult you can't solve, you have to send the case to order. So order is there.
So the drivers who assist you, they are commercial vehicle drivers?
Yes.
Okay. For a fee?
Yes. Depending the hour to the time, the period that you call them. From 12 midnight, the amount is heavier. Let's say during the time like this, maybe 20 Ghana. But from 1 a.m., 2 a.m., 3 a.m., the man can say 30. And because the case is very serious, you have to pay so that...
They take the patient.
Sometimes the patient may not pay. I've been paying myself. I put my own money because I want to save life.
Okay.
So this is the place that I bath my babies. This is my Sankey machine. Here I boil my instruments.
You boil the instruments in this one?
Yes. I plug it.
Okay. You boil the instruments.
And this is my sucker. When I want to suck the baby, I could just plug it here, then it starts working. I weigh them. This is my sucking, my ambu bag. But sometimes when the abgas core is okay, then I don't use those instruments. I put them here, wrap them before I do my bathing. Then I discharge them.
Okay, so you bath them in this thing.
And it's of later that you have got this pipe.
You didn't have pipe?
No. I'm roughly 1 month now. So I've been using this Veronica bucket. I fed the water from the tank, fill it here before I use it. Because right now we are free. Have it.
At least you have running water.
As for that, I like it now.
And this place too has the regular roof.
When it rains right now, that's why this one is all the time here.
Oh, okay.
It leaks.
So when it rains, you keep...
This bowl is always here because of the leaking.
Oh, okay. Okay, so this is the young man who introduced us to the Achiase Health Center. Yes, this is the young man who introduced us. Why did you send us that message about this hospital?
It's like the people here are really suffering. Like they want to come here, but because of the structures and everything, they don't come at all. They have to pay extra, take extra money, then go to the nearest town. So because we have this here, it is very wise that we maintain it and then we use it. We don't have to just look at them and then go waste. So we decided that let's help and then bring everything which is necessary to keep the hospital going so that our lives can be saved at the shortest possible time. That is why I drew your attention to that fact.
Okay. Good. But have you ever come here to seek medical attention, or do you know someone who has been here, or?
I've not come here personally, but my big bro came here. Yeah, and then because of what happened, yeah, he wasn't able to like take the medication here, so he has to go to the next town, which is Odan. So that was where he took the medication and everything. Yeah.
Okay. Madam, this place, this room, this place that is you have 2 beds and a fridge, sharing the space with the generator. This is all part of the labor ward?
Yes.
Okay.
When they come, I sit here, then I watch them. We are 2. One is now on leave. One sleeps here. When the cases are 2 or 3, one sleep here and I also sleep here during the night, especially primips. Their delivery delays, so we sleep with them here. So these are, the nurse's bed. The generator, when you have light off, you use it.
Okay. Okay.
So this about this room.
I suppose the generator, somebody donated it, or?
Yes, from the barracks.
The people from the barracks donated the generator. That's nice. The list of drivers who have been assisting the hospital to take emergency cases to Odan, referral cases. Yeah, referral cases to Odan when there are no Tokujo, Tutu, Mr. J, Meko, Meku. Yeah, William Ima Apia or Bing Kweku. Huh. Community, and you call them community ambulance. It is really not a funny case. It's a serious case, but pathetic case. You can't take that away. It's a pathetic situation here at the Achiase Health Center. And this is the bathroom, and it also has the regular roofing problem. So a pregnant woman could be bathing and then broom. Some more. The hallway is falling, broken, empty liquor plates. So you're saying this place was put up by Kwame Nkrumah?
That's the street that this place in 1960s. Yes. Lying word for OPD.
Okay. Signage. Maternity ward signage. You are a young nurse.
Yes.
A very young nurse.
Yeah.
You can work somewhere else, right?
Yeah.
And you always want to do that?
Yes.
Why?
Because looking at our facility, we need so many things. We need renovation. Look at our walls. We have only 2 beds. If like I'm to be working at Kolebu, I'll be very happy. But here's the case that people also need our help. So we had to come and work. So that's why we are here.
The female, that's the female ward.
Yes, yes, yes.
Can we also have just, can I look into that?
Yes, come in. We have only 2 beds over here.
The cases are okay. They send some of them to my bed.
Your maternity bed?
Yes. To observe them.
We have only 2 beds over here.
And for the kids.
So that's the same applies to the male. But the male, only 2 beds are there. So when people come and it's like 3 people should be detained. We can't detain all of them. We have to refer some to other government hospital. Because since time immemorial, no renovation, nothing. And some of the things here, we even improvise. A lot of things. We don't have enough to work with.
I see. This thing too is very rusty.
Yes, they are very old. We are not getting new ones. So we are managing with them. We come with dust and we use them.
Sometimes you put a white cloth on it, make it look like it is new.
I sold.
I see. The male ward?
Yeah.
So your male ward male observation ward has just 2 beds. No, I mean, we don't call this a bed.
We were having this mattress on it, but we had a cholera case and the person saw the bed and it was so much soup. So we decided to just take it off so that it wouldn't cause any further infection. That is why. So now we don't have any bed on it. That is how it is.
So if there's a case, I mean, people come to the clinic and you need to bring, there are 2 men or 3 men. What do you do?
This thing came just last week. So that question there, I'll leave it for my in charge to answer. But definitely, as you see it, maybe the first one will lie on this. And maybe the second one, either we will get maybe cloth to cover it for the person to lie on. That's the only option we can give. But that bed is now spoiled, so you cannot use it again.
Because of the cholera?
The cholera, yeah.
I see. And the roof is always the roof.
There's one nurse.
These are laboratory, but they've closed. They've gone home.
What time do they close?
It's like, you see, right now I'm for afternoon. I'm the only person on duty because we don't have enough staff so we come 1-1. Even night duty, I have to come alone. If someone comes, I have to pick the person's folder, take the person's vital signs, do consulting, give drugs. If the person is supposed to be detained, I'll detain the person, be moving up and down. So it's not easy. It's not easy over here.
What's your name?
I'm Elizabeth Tay.
Elizabeth Tay.
Yes.
Wow. And so the lab too has just 1 person?
There are 2.
Okay.
The one is just here. So I called him the other day when somebody came. I saw that the HB was very low. And she will deliver very soon. So I have to call him to come and see whether the person, there's enough blood before I do that delivery. So we'll run and come and help. The house is just here.
So anyway, everybody here is sacrificing.
Yes. It's very. Since 3 weeks, I've not been sleeping. I'm alone because we are 2. One is on leave. So I'm here alone.
Morning and evening?
Morning and evening. Anytime I'm here. So we are those of us sleeping on this compound, we are on call. Right now I have to be in the house cooking, but I'm here.
These are treatment rooms. Yeah, we do wound dressing. If anybody comes with any cuts, we suture over here. We do wound dressing over here.
Okay.
So that's what we do over here.
In other hospitals, is this how they are?
No, no. Just that we are not lucky. I may say that because everybody wants to work at a place where should be recognized or a very neat place, but we are here. We can't do anything about it. We have to help the people. So.
And this one too, you are able to use this pipe because just a month ago you had this philanthropist helping.
We've been using the Veronica bucket, and now we have the tap flowing, so we can use water.
Oh, use that. I see.
Injection room stroke nurses.
Quarters.
Nurses room.
Nurses room.
Yes. So this is where we sleep. When I come on night duty, I come alone. This is where I sleep. So if any patient come, the security man will come and call me, and I'll go and attend to the patient. Okay. And this is where we give injections. So these are the needles.
I see.
We had to improvise too.
One of the things I don't like about hospital is the smell of injections. And that is what I'm smelling in here. So I am so in a hurry to get out of here. So this is what is happening in here. The only thing that seemed to be new in this hospital are the sink in the various offices, which we are told was donated by a philanthropist about a month ago. And also the posters, tuberculosis posters, prevents cholera posters, and all those things. The posters seem to be the newest thing in this hospital that was constructed, that was built in the 1960s. Everything here is rotten, from the roof to the ground.
This is where we sell the drugs. After consulting, the patients come for this.
Is this all you have in your dispensary?
No, we have a store.
A store. Oh, okay.
The store.
So they bring someone out.
Okay.
So this is where we sell the drugs.
I see. No, wait. But this place too, when it rains, then it's bad because this place doesn't have the roof.
No, this
problem.
place, the philanthropy moved this place.
Oh, okay.
So when you go out, you
see the
this part is
new.
They gave you a new roof.
Yes.
The ceiling is old though.
Only this side.
Oh, so that at least your drugs will be safe. But then when it rains, because of the louvers, the rain still comes in. But as always, your posters are looking beautiful. Beautiful posters. You know, flow charts for diagnosis and treatment of malaria. Reception.
Hey, Lavance.
This one is old. Oh, my name is Abla. The console, it's not locked.
It's not like that.
Let's have a look at the. This is the reception. which also doubles as the accounts office, right? Yeah, the reception doubling as accounts office. Also has very beautiful new posters on malaria and mosquito nets. Even the fan in here tells you how old the structure is. Oh, you have been given nose masks for Ebola. Oh, I see. At least you have something, right? Yeah, you have something.
We do education and allow this to various churches.
You've been going to churches?
Churches for education on Ebola and cholera cases.
Okay. So you received, is it an award?
Yes.
So in spite of the situation here, in spite of the porous infrastructure, in spite of all the difficulties, this health facility is still achieving and gaining awards.
Yes. I was here. We had the third prize because of the hard work that we do. Our referrals, how we wake up in the night to do the delivery and all that. We had this award. But then Chief Dake was here.
That's nice. Under the
Achiase sub-district.
You have how many?
Insuansa, Chief Zone, Teshiman, Chief Zone, Ostrasi, Chief Zone.
All under this place.
This Achiase sub-district.
And so if your mission statement is to seek the overall, health, improve the overall health status of people, and your structures are bad, it's how for do, yeah?
Because they are at the Chief Zone, very remote area. So when they have difficulties, they bring their cases here to come and see the medical assistants for help.
The only machine we have here is the BP apparatus. We don't have any other machine apart from this BP apparatus. So if anybody is in a critical condition, when you are referring them to, they don't understand why you should refer them. Nurses are here, the medical assistant is here, midwives are here. The person will not understand you that you are referring him or her to Odan Government Hospital because he thinks this place is a hospital, so we should have all the facilities over here. But we don't have.
So you have to explain that as we do things at our level, this health center, and there are some drugs that we don't dispense here, unless the person goes to Oda. So sometimes you keep on educating that it's a level.
Okay.
Sometimes they will not understand.
They don't understand.
Because the case is critical, you have to refer.
Send them.
Okay, she's currently at a meeting.
Oh,
the DDHS group is organizing a meeting, and that's where she is currently.
I hope you are.
I'm Isian.
I want to join you. I do this program. So
Okay.
what are you here?
I'm the district disease control officer, Ghana Health Service.
Okay. So I suppose you've been told we went to the Achiase hospital, right? Can you answer questions on that?
Yes, I've been informed we went there, and I've been in the district for a while, so possibly. It's actually not a hospital, but it's a health center. Yeah, we have the levels, and it is, I might say, the largest public health facility in the district. The district was carved in 2008 out of the Denbrim South. So since the carving of the district, Achiase Health Center is a public health facility which serves the people of Achiase and then the surrounding communities.
So it's a health center.
Yeah.
Should there be an upgrade, it becomes a hospital? Is that it?
Yes, that's what we anticipate.
That the facility would be upgraded soon so it becomes a hospital. But you and I agree that the state in which that place is not the best, right?
Yes, it's not the best. And we've been anticipating that it will be upgraded to a hospital status right from the inception of the district, the inauguration. And it has been a priority of the Assembly ever since, as well as a priority of the District of Directorate. It has remained on top of our issues, and we've been advocating for it. But for the time being, once it has not been upgraded, then what we are doing is our little best to maintain the place, to take care of the people we serve.
So we have taken a tour of the Achiase Health Center. We've taken a whole tour, every facility, every room, and as the young nurse said, the only machine, the only equipment they have here is the BP apparatus. Is this the health treatment? Is this the health care we want to offer our people? For Joy News, I am Seria Mabladi Souza, Achiase in the Eastern region.